Hey all, welcome to ShareTrek. This is Raj here, and today I want to talk about GlaxoSmithKline. The reason is that, in my personal opinion, GSK has done something now that is not positive for the genomic industry. But of course, progress of the genomics industry is going to have its ups and downs because progress never comes in a straight line. It's always full of surprises. We are definitely going positive in genomics, but there are some setbacks here and there, and this is one of them. So let's get started. Welcome back, friends. GlaxoSmithKline, or we'll call it as GSK going forward, it's much easier to pronounce, is a company that consists of three business segments. One of them is pharma, another is vaccines, and the third is the consumer healthcare. Their pharma and vaccine segments focus on offerings targeting immune system, human genetics, and advanced technology, whereas their consumer brands focus on pain relief, cold, allergy, flu, oral health, and also vitamins and supplements. On 23rd of June 2021, GSK announced that it will spin off its consumer healthcare division into a separate listed company. This was expected to improve the profitability of the pure pharma business. Later, around October 2021, Sandoz completed the acquisition of GSK's cephalosporin business. That included three established brands sold in more than 100 countries. And those were Zynath, Zenafsef, and Fortum. This came in the backdrop of an earlier alliance Lyell forged in 2019 with GSK, or rather GSK forged with Lyell in 2019. The interesting thing about Lyell Immuno is that it is into novel T-cell programming technologies and adaptive cell therapy for solid tumors. The deal between GSK and Lyell was a 5-year collaboration focusing on cell therapies for cancer patients and was thought to be synergistic to GSK's own GSK 33777994 therapy that targets the NY-ESO1 antigen that is expressed across multiple cancer lines. At that time, GSK CSO Dr. Hal Barron had said that we are witnessing significant scientific innovation in cell and gene therapies, transforming the treatment of some blood-borne cancers. But patients with solid tumors are in need of equally effective treatments, applying Lyell's novel approach to counter T-cell exhaustion and working with world-class scientists such as Rick Klausner and his impressive team increases our probability of delivering the next generation of cancer cell therapies for patients with solid tumors. At that time, it seemed to me that GSK was becoming more focused on pharma by hiving off its consumer healthcare and tying up with Lyell for CAR-T therapies. GSK had invested around $439 million in Series C funding in Lyell Immuno at that time. I could not find further financial information on this deal, but that's a lot of money. Hal Barron departed GSK in August 2022, and fast forward, today we have news that GSK's new CSO, Tony Wood, has changed direction and dropped the Lyell alliance. GSK also pulled the plug on its NY-ESO and PRAME programs with Adapt Immune. It seems that the new CSO is more conservative in its approach. This comes across in the statement from GSK disclosed by Lyell. It reads, "One of the key features of our R&D approach and the culture change we have been driving with our R&D organization is to be more hard-headed around which pipeline assets to prioritize and which to discontinue. Rather than continuing to fund R&D programs for which we don't have sufficient confidence will result in approved medicines and vaccines, this investment will instead be redirected towards the pipeline assets where we see the greatest potential to make a difference for our patients." Lyell further went on and released a statement that reads, Lyell's understanding is that the discontinuation of the program is based on a strategic review of GSK's pipeline and follows Lyell's update in August 2022 that GSK had received data from study of its first-generation lete-cel product candidate from Adapt Immune in non-small cell cancer, which does not incorporate any of Lyell's reprogramming technologies. The investigational new drug IND application for LYL-132 was cleared in January 2022, and the IND for LYL-331 has not yet been submitted to the US Food and Drug Administration. Given the early stage of these second-generation programs, the termination is not based on clinical efficacy or safety data from these programs, but it's some other objective of GSK. That's what Lyell Immuno is telling us. To restore confidence in the fact that their programs are still viable and they're continuing on with it. Well, that is the story. And here is what I think about this. We have a change of leadership at GSK that has decided to be conservative and strategic. They want to be having a focus on pipeline items that they think are low risk and high reward, and also want to channel resources from riskier ventures into their convictions. While LYL-132 getting IND enabled in January 2022 is evidence of its viability, GSK's decision should not be seen as a vote against CAR-T therapies. Time will tell if this was the right decision for GSK. I think growth, innovation, and developments do not happen in a straight line. There are many ups and downs along the way. The future will tell if GSK took the right decision. They seem to be going through a churn and have been reconfiguring for the last 2 years. And I hope that they find the right configuration for their future and for the shareholders. That's all from me today, my friends. Please do not hesitate to press a like and subscribe button to join our investor community and help me grow this channel. Thanks and have a great day. Bye for now.